Secretary for Labour and Welfare Chris Soon says the government is looking to refine how it identifies vulnerable elderly households. He says authorities are exploring new parameters such as hospital records to include high-risk groups or carers in their 60s. Jackie Len spoke with the welfare chief.
At Liking Estate on Friday, an 80-year-old woman was found dead alongside her 71-year-old husband who had taken his own life. The double tragedy has sparked questions on whether the government is doing enough to identify at-risk elderly households. Speaking on TVB News, Secretary for Labour and Welfare Chris Soon says the government has earlier introduced a carer support data platform to improve cross-departmental coordination. Soon says authorities are now considering support expansion to more vulnerable groups under 80, including those suffering from chronic illnesses.
But we still see a lot of several more strategies in recent months. Are there more groups to be pinpointed as high-risk elderly so we can devote more resources?
We're starting with by cutting off those all elderly families over the age of 80 or above. So this is the starting point. But clearly, there's more we can do. As reviewed by the tragedy 2 days ago, there will be households, while their age is below the 80s, their needs for support could be high. One example we could think of is if one of the residents is suffering from chronic disease that requires a lot of care and attention. Perhaps their risk could be as high as those over the age of 80. So we are exploring the possibility of, apart from age, we could introduce another parameter, including record from the hospital authority if they're suffering from a chronic disease, say for example dementia. So that will put a lot of strain on their carer. We should just also include them into our list of high-risk families and ask the care team to visit them as a matter of priority.
A decision on updated thresholds for intervention is expected as soon as possible. The government has recently unveiled the report on impact of targeted poverty alleviation strategy.
The report introduced a concept of social transfer value to quantify various social welfare policies. How do you think it's going to help with the measurement of effectiveness of poverty alleviation measures of Hong Kong?
The purpose to provide a clearer picture to members of the public about the vast resources invested by the government in education, medical, social welfare, and also public housing. It's a more clearer way for us to try to visualize the impact of government services.
When asked whether the government's push to regulate substandard subdivided units in basic housing unit policies might mean less support for other tenants still living in poor conditions, Soon points to the expansion of community living rooms as a key relief measure.
What we're doing is trying to provide support from various fronts through the community living rooms. So we're providing extra extended space so that they can cook, they can wash their clothes, and their children could go there to study and learn from others.
He says more than 14 such facilities are already in operation, with at least 4 more poised to launch this year. Around 10,000 subdivided unit households are expected to benefit. Despite positive feedback, Soon has stopped short of confirming whether the scheme will be regularized to become a permanent service, at least for now. He says that's because the program is now funded by the Community Care Fund, noting authorities will continue to assess effectiveness through data analysis, including support from the business sector. Jackie Ling, TVB News.